little friend out here. This is like your second baby, though, we do say. Give you a little push. Let's see if I can squeeze it out. I think that this is a lipoma, but it could just be herniated fat. At worst, it could be a arteriovenous malformation. Could this be filled with blood vessels? And that would not be a good thing. I think that it's a lipoma, though, so I'm gonna proceed with caution. I'm gonna numb the area, and I'm always gonna take a conservative little peekaboo look. All right, so you shouldn't feel anything other than us touching you, okay? Nothing should be sharp and uncomfortable. Okay, we're about to start here, and I was a little more hesitant when we were outside because when you were bending over like that, it looked like it was really in a tough spot and very tight, but looks like a lipoma. It looks like I can remove this, so I'm gonna give it a try, okay?
Yeah, let's do this.
Have you always been this like happy-go-lucky? You really are like a very
I'm always positive, I'm always happy.
Yes, I like that. Just wants to ooze a little bit more. He's got a lot of nice little, because he's got a nice tush, I guess. He's got like a good blood supply there. Like, I don't want to see you mad, because then you're probably, people are like, oh my God, what's going on now? I'm gonna buzz, make sure, is he touching anything metal? No. Okay, good. I'm gonna buzz you here, you shouldn't feel anything. Let's see if I can get it out with not too much problems here. Let's see, it likes to ooze on us. Fresh out of the gates, I see some pretty consistent and persistent bleeding, and I really want to take my time and cauterize these areas. I want to try to nip any of these bleeders in the bud before things get out of control.
Hopefully it's not attached to the muscle.
Yes. It feels pretty good right now. I'm gonna loosen it up soon and then try to dab right there again. That's the little blood vessel there. I can see it right there. It's connected to him. Come on. I'm gonna tie it off more right there. Just trying to help this little annoying vessel right here so we can pull this off. I do see that there's definitely a bleeder here, and I really need to get it. This is a really mobile area. He's gonna stand up and sit down and squat. It is already prone to bleed on its own with movement here. And so if I have a bleeder there that is not controlled, he's just gonna have essentially a bag of clotted blood in the area, like Jell-O. You don't wanna have a third butt of blood. I finally feel comfortable with the control of the blood vessels. There doesn't seem to be any active bleeding now, and so now I need to tackle the lipoma. I don't think it's gonna pop out so nice and easy. Come on. It's like a baby that's crying. There we go. Did you feel that release?
Yes. Woo.
Let me see if I can't tease that out now. Gently on him. I've been able to express the majority of Kevin's lipoma here, but it's just kind of holding on by some bare fibrous tissue here. So I just gotta snip that last bit off. It's right up against your edge of your leg, and I'm trying to pull it away without pulling too hard. You okay?
I'm okay.
Good. We're almost done here, actually. Go. Got it out. So I'm just gonna buzz you now and close you up, okay? Gonna have to try to minimize movements here, but obviously whenever you sit and move around, you know what I mean? This area gets stretched. I am stitching up this incision really nicely just so it's hidden out under the crease of his booty cheek. I'm gonna put in more stitches because I do think that these little gaps here can cause it to ooze a little bit more too from these gaps, so. I'm taking some extra care, putting in some extra deep sutures because this is an area under a lot of tension and I don't want him to bend over and pop out those sutures. So important in the next 24 hours because that's when you can bleed more. Kevin's got his booty back and I can't wait to show him his results. Okay, it looks really good. Just a little bit puffy, which is normal. Can you see that?
Oh, yeah, I can.
See how it's a little, right, and when you're standing, it'll be flattened like this.
When Dr. Lee handed me the mirror, it was very surprising and shocking. My heart was pounding out of excitement. There's no bump there. I just saw flat with stitches. I wish I could get off the chair and just celebrate and run all up on the street because it's a celebration for me, living lipoma free.
See that part right there?
It was this.
That's probably the part that was in the end. You know how it was bulging out?
I will be very careful in the next coming days, weeks, to not mess this thing up. I'm gonna be very happy coaching, exercise. This lump was getting me stressed every day. Now I can live life like a normal human being. I'm very excited. I can't even talk right now.
Close your eyes just so I don't stick my finger in your eye. Great. Baby pinch. Whenever I plan an incision on the face, I'm always trying to hide the scar as much as possible. And one of the most common ways to do this is to hide them in resting skin tension lines. And in this case, on the forehead, that would be along our forehead lines. The other thing that I'm aware of is trying to keep an incision as small as possible. I'm not 100% sure what this is. I don't really know what to expect yet, and I won't know until I get started. Okay. This might kind of squirt at us here.
Okay.
I think it's open a little here on this side, yeah. Sorry, it spit at us a little bit. There's it is a cyst.
It is a cyst?
Yeah. Gonna squeeze it. Sorry, I'm squeezing it out of you, just nothing using sharp, you know what I mean? So that I don't traumatize or cause any other issues, but I just wanna squeeze a lot of it out so that I can numb underneath it. Because of the size of this growth and the fact that it's filled with contents that are under pressure, I really need to squeeze the contents out first because it's gonna allow me to see what's going on underneath. I mean, this big balloon is just in the way. We're just trying to take our time here and, okay, here, getting underneath it, so just wanna kind of tease around it. I'm trying to get under the sac and really try to scrape the sac well off of her skull, but I'm also concerned that this is gonna start to get uncomfortable for Krystal. I know that Krystal is hearing things, so I just really need to try to make her as comfortable as possible. So what do you like to do for fun?
I am a practicing witch.
A practicing witch?
Yes.
Do you think that witchcraft caused this? And
I feel as though my spiritual side is pushing out the things that I don't need anymore.
I've never thought about it, but maybe cysts and lipomas are just this bad spiritual energy that's just trying to get out of you. Just keep it like that. The other theories could be benign fatty tissue and old skin cells. Okay. I'm relieved to finally have this procedure over. I was able to make the incision nice and small. I think I was able to remove the cyst entirely. Now I think I need to burn some sage. Why don't you hold this? Okay. See the L there?
Oh my God. Oh, I can't believe it's going.
Yes, it's gonna look really good. It's just bumpy now. Oh. It was like so much pain and like up, you know, I feel like all the negativity was in there.
I'm looking in the mirror for the first time and it's almost, I don't even believe it, you know? And me. Dr. Lee, seriously, she is an amazing soul and I can see so many more possibilities in my life because of her.
You look great. You're so beautiful. And you're amazing.
I think that now I'll be unstoppable on TikTok because there's nothing holding me back anymore. People will know me for me and my voice and not my bump.
Carla came to see me all the way from Mississippi to remove 5 pilar cysts on her scalp. It's not uncommon for me to see nervous patients, but I think that's my specialty. Okay?
I'm doing good.
Good. See, you're good. You're a pro.
Hi. I'm extremely relieved I didn't have to get my hair cut off. She had to trim a little bit, but I was kind of worried about being bald.
Put my splash screen on.
Oh, you're probably gonna need that.
Oh, you think so?
I have very old cysts. One of them is 35 years old. They need retiring.
We'll do this bigger one first, huh? What do you say?
All right, let's get Big Bertha going out
Yes, break Bertha, the one that's been with you for the longest.
now. Yes.
All right, 35 years. 35 years. I see the cyst here. I see him.
Do you?
I see Bertha. Yep, it's looking at me. It's giving me the evil eye. You're doing great, honey.
Did it pop
Careful
out?
that, careful that. Yeah, it's pretty much sitting up. It looks like a little rubber ducky. Upside down rubber ducky.
I am so thrilled it came out like that.
Big Bertha came out intact, and that is always fantastic because it means that I got the whole thing out. If there's a part of it left, it can regrow. Okay, I'm gonna put him down. You can see him later.
He's out?
Yep. Now I'm gonna put some stitches here.
I am amazed at how it feels.
Isn't it? How simple, you like wonder, why did I wait so long, you know? Okay, ready? Number 2. There we go, that one opened a little bit. It's cute, you'll see it. You know, when you have a cyst that's been there for a long time, there is more likelihood that there could be more of an odor to it. Imagine skin that's been sitting, stored in this balloon for 35 years. That's what it smells like. They're all cute. You okay?
I'm good.
Last little bit, twinsy here, okay?
All right.
This is a bigger one. This is the second biggest one you got.
Okay.
See, that's like a twofer.
I heard
It's got
it.
goo on one side
Does it?
and non-goo on the other.
You did save the best for the last.
Yes, I agree. That looks great. How was that? Not too bad?
That was wonderful, Dr. Lee.
You see them?
Wow, they are aliens.
So this is that first one. That's Bertha.
Big Bertha?
Yeah, you see, and it kind of grew, and it grew like little knobs on it.
Wow.
Now this is like a cyst, a traditional pilar cyst. We will send it in to pathology to make sure it's nothing to worry about. But
Okay.
I don't think you should lose any sleep over it. Do you want to touch it?
Yes, I do.
Okay, sure. I'll let you squeeze it then for me, okay?
Okay.
I'm gonna let you squeeze it. Let me show you. Can you grab her some gloves? Carla's cysts were not all intact when I removed them, but I was able to remove the sac that contains each one entirely, so they're not coming back.
Can I hold it? That is awesome! Oh my gosh! I cannot believe this darn thing has been in my head for 35 years. How gross. Oh my Lanta. I think that is the most disgusting thing that I could ever imagine was in my head.
All your little friends are gone.
Well, bye, friends.
I'm excited about this one because I know that this is going to change her self-confidence pretty much instantly. So let's get rid of this thing, Brenda. This looks like it's probably a lipoma. I can't say for sure until you were to remove it, but I'm sure that that is something that you would really like to do because I can see that, you know, it's noticeable on you. Lipoma is a benign collection of fat, so it's not something to worry about. Raise your eyebrows. Okay, good. Okay, let me put some numbing there, okay.
I am feeling right now, I'm very nervous, but I trust her and I have faith in her that everything will be okay.
How are you?
I'm good.
Yeah, you feeling okay?
Just a little more numb already.
Okay, good. And you're the most important, like I said, so if anything ever bothers you, you please make sure you let me know.
Okay, I will.
A growth like this that is on your forehead, it's really in an area where there's very important nerves and vessels. I need to be very careful in the way I cut. It could be dangerous if you go in the wrong direction. I talk a lot during this, but I talk to distract you because you can kind of hear things, you know, through your head. So I see it under there. It looks like a little lipoma. Raise your eyebrows up for me. Good, you're still raising. Okay, good. Let's see if I can pull your little friend out here. This is like your second baby, though, we do say. I'm gonna give you a little push. Let's see if I can squeeze it out. You're doing fantastic. See if I can get him out. Sorry, my sounds. La la la, la la la. He's out.
Did it pop out?
Yep, it did. No matter where I put stitches, it's very important to me that they are as perfect as I can get them. Fantastic, if I do say so myself. You know, you don't want a Harry Potter scar up there, or you don't want something, this badge that showed everybody that you had something there. You want it to just try to go away like poof with a magic wand. It's very important to me that the sutures are perfect. All right, here, I'm gonna show it to you, okay? You ready?
Okay. I haven't seen this face in years. Oh, wow.
One of my favorite things to do in these instances is to show my patient the mirror because I love to see their reaction. I love to see them, their eyes light up. We've changed the profile of Brenda's face. It's not only that, we've really changed her internally, increasing her self-confidence and hopefully her happiness.
It's gone. Looking in the mirror, I felt like my old self is back because now my bump isn't there, so it's very life-changing. Thank you so much for doing that. Thank you.
Oh, you're so welcome. That made my day.
You made my day. I'm gonna be able to enjoy not being able to see my bump right there anymore.
So we put that numbing under there. I should just take it easy, actually, though, because if just in case it's not a lipoma. I've just started the surgery on Shane to remove this big bump on his shoulder. It could be a lipoma, it could be a cyst, it could be something else, but I do know that he needs this thing off his back. I don't want it to, like, explode on me here. That's why we wear splash guards. Looks like it is so far, though.
You cutting?
I am.
Oh.
Isn't that weird? Wouldn't even know,
Sure?
huh? I'm sure I am. It's amazing what you can do under local anesthesia, isn't it?
Yeah, it is.
Just undermining a little with my fingers. It's a much safer way to do it, you know, because you can feel and also you can really loosen something up without using anything sharp. This is literally a deep tissue massage. All right, ready? I think we're gonna get a nice little pop here.
I'm almost a little sad that I'm gonna lose part of them.
Yeah, right.
Oh.
Oops, sorry, splash there.
Oh, dude. Looks like a brain just came out of your back.
Really?
Yeah.
Not a boob? Not a boob anymore?
So that's just fat, or?
It is. I'm going to show it to you in a little bit. You'll be able to see it. Do you feel lighter? Oh, I almost dropped him.
She almost dropped her baby.
Yikes.
You dropped my boob?
So had been a 5-second rule I would have gotten, okay? So it looked like we got it pretty much out entirely.
So will that grow back?
It shouldn't if we got it all. I think we did. But you can see where the space that it was holding. If I lift up, that was like the whole space it was in. Is there anything you want me to put in here? Last call.
Nope, you're
Anything
good.
you need to put in here?
Can we
No?
put a GPS in there
You should.
so I can track him?
I was really happy that now I can go back to normal when I go to work. I don't have to have this big old freaking lump on my back.
Now you look like Frankenstein.
Sean will probably find something else to nag me about, but it was a good peace of mind for me that now it's been taken care of. And where was it attached to in my body?
It wasn't. It's just one fat cell just started growing itself. That's why it popped out.
Yeah.
It was a good pop. Just a little, oh, don't shake.
I'm concentrating on not spazzing out.
I understand, that's okay. You're doing fantastic, okay? John has come in to see me today, and he has this growth, this lump on his side that actually resembles a boob. I can really see that he's very nervous. He is quivering, he is shaking. I need to make sure that he's nice and comfortable for us to be able to do this surgery successfully. Okay, cutie. You're the most important here. You should always feel comfortable. You might just feel me pushing on you, but you shouldn't feel anything sharp. Make sure I'm never hurting you, okay?
Yeah.
Good, you're doing awesome. We got a lipoma here for sure.
I'm glad I can't see it. If
Yeah,
there was like
good.
a mirror up there,
Good.
I wouldn't look at it.
You wouldn't look at it?
No.
Don't need to look at it. I'm just gonna try to get rid of some of the fibrous connections that's like stuck to you here. I'm just gonna release it a little bit with my fingers, moving it around, see if I can't squeeze it out even. You're doing awesome. You can see there's little connections and fibrous bands, so I'm just trying to break them up here. Your boob is out.
Yay!
It is out.
If you find my car keys in there, let me know. I am overjoyed that my side boob is no longer. I am grateful. I'm grateful.
Looking gorgeous. I mean, that looks good. It's got a little swelling there. It looks like a normal hip.
Thank you so much. You are my hero.
John's side boob is out. We will, of course, though, send this to pathology to make sure it is nothing to worry about, but he is now boobless. here is your lipoma.
Wow.
That was your jiggle right there.
Wow.
You want to hold it?
No.
I didn't think so. But there you go.
Thank you so much.
Oh, you're so welcome. I adore you. Oh, you're so cute.
It's been a long
It's
time.
gone. It's gone. It's done. Guess what? Goodbye.
I got a little emotional because I usually keep a lot of that close to my chest. I try not to show my feelings, but this was just a long time coming. Thank you so much.
You're awesome. You're amazing.
I am. So are you.
No,
You
you're-
deserve all the credit. I was just saying there was
you're
no
amazing.
pain, it was painless.
Yes, but to have somebody like wonderful like you that has such good energy to come into our office, it's always a good thing.
Thank
You make
so
me
much.
cry, man. When you're embarrassed about some kind of growth or some kind of skin condition you have, it's easy to make jokes because that oftentimes takes the pressure off. And John's a prime example of this. And for somebody to sort of really put down their armor and you see how much this has deeply affected them right after you remove it, it makes you feel good. Antonio's got a bump right over the center of his spine, and that's a spot that is gonna give a person some concern. The fact that it's really movable tells me that it's not bound down or not stuck down to his spinal cord, so I feel pretty good that it's not involving his spinal cord. All right, let me put some numbing right here. Just a baby pinch here, okay?
I felt that pinch.
I'm sorry.
I'm not a fan of needles.
Me neither.
As long as I don't see it, I think I'm all right.
That's good, yeah. You seem to be pretty good. Okay. All right, we got this bump all primed. It's kind of firm, it's hard because it's filled with fluid. So hopefully that's not a cyst and it's gonna pop out at us.
I am a little worried about the needles and the scalpels, everything being so close to my spine.
All right, let's see what's going on here.
Worst fear is somebody sneezes and the scalpel goes into my spine and now I'm paralyzed.
So we made this little off of your spinal cord. You know, I don't like the idea of going straight down towards your spinal cord, certainly. Antonio has this lump right smack in the middle of his back, right along his spinal cord. You know, all your really important nerves come out from that area to kind of feed the use of your arms. So I've got to be careful when we remove this bump. You don't want to get into any problems. I'm gonna tug on you. If it's stuck, until I tease it away, it tugs a little bit. Oh my gosh. I'm too weak. You're proud?
Yeah.
Dang it. Oh gosh. It's stuck a little bit, but I think I can get it if I just move, if I just kind of shimmy around it. So bear with me here. Antonio's lipoma is not being cooperative. It is certainly giving me a little fight. It is fighting back. It's like a workout. I'm panting afterwards. It's really hard for me to predict whether something is gonna pop out or not. And his certainly has stuck its little claws in his back. It doesn't wanna let go. I'm just trying to stay calm to make sure that I can remove this very safely and not really encounter any deeper structures. All right, he's not gonna come out one full piece, but close. He's got like feet, he's got like hands and feet here. That's the problem. Sorry, lovely noises yours makes. You got a definite chicken cutlet here. Ooh, what noises you got here? You okay, right?
Yeah, I'm okay.
Good. This lipoma is a tough one. It is grumpy, it is stubborn, it doesn't want to come out of its hole, and I have to be really careful with working with it. I don't want to force it out too quickly because it is stuck underneath, and you know, right underneath there is the spinal cord, and I don't want to get anywhere close to his spinal cord. So I really don't want to blindly cut with a scissors or a sharp blade under this lipoma. I really got to coax it out very gently.
Breathing kind of hard.
Oh, because I was working out.
Dr. Lee's breathing hard and it's setting off my spider sense. I'm a little nervous and worried about it. My shoulders and my arms are really tense.
You can tell if I'm distressed, if I'm concerned. I know. You see that I'm not, though.
Yeah, you're good.
More excited. Come on. Come on. This looks good. It was a little bit wrapped in fibrous tissue. That's why it took me a little bit longer. I'm gonna put stitches in right now. We're done.
Oh, yeah.
So this was a tough one, removing a big lipoma out of this little incision. And, you know, it took me longer than it would if I made the incision twice as long, certainly. But I really think that was worth it because I really think it's important for him to leave my office with this tattoo really intact and his love intact as well.
Okay, do you want to just sit up? Just be really careful.
Careful with your back there.
There are a couple of moments where I knew where everybody in the room was, my path to the door, and I was gonna hit the back door. But we didn't have to go that route. Yeah, she did a good job, and I'm happy. Dr. Lee, I really thank you from the bottom of my heart. My daughters thank you, my wife thanks you, and I'm happy to come back anytime just to say hello.
All right, let's see what this is. Janice and Cheri are here. They're sisters, and they both have bumps on their upper body. I've removed Janice's bump already, and it proves to be a lipoma, but I'm actually more interested in seeing what Cheri has under her skin. It's right there, too. It's a cyst. It's a cyst, and it's right there.
Is it totally not squirting out or anything?
Not yet, but it's right there. All right, we ready? There we go, here we go. Let me make it a little bit bigger. It's a cyst for sure. Do you see that, Sissy? Can you see that?
Can't see it. Oh my gosh. Oh, good grief.
Let's put it into the basin too, okay?
So what's the smelly?
That's cyst. It's like old skin cells that are stuck under you for years, for 15 years. I feel like it would smell like toe jam or something, something that's like your skin's been sitting there for a while. That's essentially what the smell is. I'm putting numbing there, okay? Because I have to now, like, evacuate this whole sac. So you're gonna feel more numbing here. I gotta just,
Are you okay?
Yeah.
Don't you think it's cool?
Yeah.
I never thought you'd be able to sit here and watch this.
I think you're turning her into one of us. This is like the sac wall, and we have to get it out, otherwise that's what makes it kind of come back.
It's just so
weird that's
weird.
Part of you. I'm pretty sure that Janice started off hating this stuff. She could not bear to watch it. But then I feel her over my shoulder peering in and watching every step of my removing the rest of Cheri's cyst. So I think I've created a popaholic. Janice, welcome to the dark side.
Oh my gosh.
There's the sac, see it? It's like a little pouch.
Oh my gosh.
I got Cheri's cyst out cleanly. It should not return. I removed Janice's lipoma, and I've gained a new fan in the process. Okay, you guys ready?
Oh, gross.
That is all skin cells.
Seriously?
Yeah. And then...
That's crazy.
And then, the coup de grace.
This is the sac that was in it. It was shedding into this. You see all that?
Oh my gosh.
Like a bladder, I would feel like, or something like that,
That's the coolest thing ever.
It is. It's pretty cool what the human body makes and causes you all this grief.
So I was really, really apprehensive about this whole thing. And I didn't really want to see any of it because I thought it sounded awful to me. But it was really, really interesting.
So
but
yeah,
I think she
it was
kinda,
really
fascinating.
I think Dr. Lee kind of sucked Janice in a little bit too. She kind of got her a little bit interested.
Yeah, that could be, yeah.
Hold this for me. So it's a little bit, yes, it's a little depressed now because there's numbing under there, okay?
Oh my gosh. That's
gonna
so
look
cool.
good.
I'm getting tears in my eyes.
Oh, that was actually
so awesome.
That was fun, and you did a really good job.
Thank you so much.
You're so welcome. I'm so happy that I was able to do that.
Dr. Lee is our new best friend.
Yes, she is. Whether she knows it or not. But we won't stalk her.
Make sure I'm never hurting you, okay? That nothing's ever sharp or uncomfortable. Leonard is here. He's got this huge bump on his arm. I know he's really terrified. He could run out at any minute. I feel like I have to move pretty quickly with him, but also make sure his nerves are calm. It's gonna be an interesting approach that I have here, I think, because I have to remove all that damaged skin and pull out this growth, but still leave him with a nice scar. I'm gonna use my finger to move around here, and that's because that's very safe. It's blunt, this section. Look, here's your lipoma coming out. You know, Chip's pretty cute.
Of course she gets that from me. I could have done this at home.
No, you could not.
Yeah.
Right. Leonard is chatty and joking. I really think that I got him to relax, but I'm always still very careful because I feel like at any moment if I said the wrong thing or did the wrong thing, he could get up and walk out. It's like a flower. I like Chip. Chip is pretty cool.
If any other woman said that to you, I'd be like, okay, Lenny, you gotta let her go.
But I'm okay, though.
Yeah, you're okay.
Your lipoma is gone now.
Oh my God.
See how it's like these globules? These are multiple lobules that were tucked in there. You saw it come out, it was like a flower.
Honestly, I am in shock right now. When I seen what come out of Leonard, I ain't got a weak stomach or nothing, but that's just not for me. Seriously, I was sitting there thinking to myself, okay, the bathroom's right around the corner, I know where it's at.
You did really good. Now let's fix you up though and make you look pretty, okay? Leonard's lipoma slipped out so nice and easily. It really was the best case scenario for him. Thank goodness. I think I really broke him down a little, but I think I relaxed him a little. Maybe he even likes doctors just a little bit. Maybe not, yeah. Maybe just me. All right, I'm done. How's that look?
A hell of a lot better.
All right, you wanna see your friend here though?
Yes.
See how it's like these globules? These are multiple lobules that were tucked in there. You saw it come out, it was like a flower. It's really pretty though, isn't it? The inside, the part that you didn't damage, is really beautiful.
It gets that from me.
Beautiful on the inside, rough on the outside, huh?
I'm proud of myself because I faced 3 of my fears today. Doctors, and losing Chip.
I thought that you were going to be a troublemaker, but you ended up being pretty cool, especially with that chip off your shoulder.
Dr. Lee will be the only doctor that I will see.
Let me know if you need anything, okay?
Thank you so much, Dr.
You're so
Lee.
welcome.
Without Chip, my life's gonna change. I'm gonna have to go out in public again. And now people won't be staring at me because they got a chip. They stare at me because I'm handsome.
Let's see what we have here, okay? I still don't know for sure what this is, so let's see. Anthony's here today. He's got a bump right smack in the middle of his face. I'm not quite sure what it is exactly, but I'm gonna find out soon because we're gonna try to remove it. Made my little line here. Make sure nothing ever hurts. And this kind of close your eyes, so keep your eyes closed in case something drips into it. Sometimes the numbing medicine can drip into there. I do like to take these out whole and clean. I don't know if I can do that with this one because I'm gonna take it out of a smaller area, but I wanna, at least it gives me an idea of what it is. You all right?
Yeah, I don't feel anything.
Good, that's the way we like it. All right, so I can see it. It's definitely a cyst, but I can't get it out of this little hole here we made. Let me see if I can wiggle around. And it's a lot bigger than what it looks like on the surface. So what I'm gonna do is I'm gonna squeeze it, okay? Now that I know that this is a cyst, I have to figure out the best way to remove this, creating as small a scar as possible, but also ensuring that I remove it entirely. I'm gonna give it a squeeze. Make sure nothing's ever hurting. Just gonna squeeze a lot of it out.
I don't feel anything.
Good.
I just feel you like
Pushing on you, right? I need to open it up a little bit more. But so far we got a little bit of it. It's this cheesy kind of texture, kind of like paper pulp. So that's what all this is. This is actually not the sac, it's just the contents of it. You're doing awesome.
Thanks.
I can feel it still under there, so. See, it's like a never ending, it keeps going. Now, have you ever gotten a black eye?
I have.
You have? Have you ever gotten a black eye from a 5-foot-tall girl, though?
No.
Well, just you wait. You're probably gonna have a little black eye. It's still the internal contents. That's not the sac. I can see a little of the sac wall right here. This is the sac wall here. See that? See the opening there? You see that? Okay. I've squeezed all the internal contents of the cyst out, so I've essentially deflated that balloon under the skin. Now I need to make sure that I get rid of all the sac wall, because if I don't, There's a chance that it can grow back bigger, it can grow back more complicated, and I am not gonna let a cystic sac knock me down, no way. Just trying to get to the bottom of it. Yeah, that's the sac. There we go, look at that part, hair coming out. It's like excavating, like I'm in a cave. All right, that is a little space you had. So the cyst that we removed, you can see that it leaves a pretty big hole, but the nice thing about where this is it's a very convex surface. So if I just push that tissue right against the skin, it really tucks down in and it's gonna stitch up and look amazing. And that's it? You wanna take a look at it now too?
Yes, please.
Okay, so here's your mirror to take a look. Look how excited you are. Is that you? You're back, huh?
Yep. As of right now, I feel like a completely different person. I feel like myself. This is the best day of my life, without a doubt.
So you shouldn't feel anything other than us touching you. We want to take that little opening out because it can grow back, especially from that area. You okay still?
Yep.
I'm here with Sharon, who has this stinky squirting cyst under her breast. She's had it removed a couple times in the past, so I really hope that there's not a lot of scar tissue here and that I can remove the cyst in its entirety so that it never comes back again. You're doing great. Make sure nothing ever hurts. I'm just removing that little piece of skin.
I'm scared when she opens it up, it's just gonna send everybody running for the hills. Oh, it's just nasty.
See what we got under there, okay? Yeah.
You see it?
Mm-hmm. I see where you're storing it. It's a little bank, a little cyst bank.
Why do they smell?
Well, it's skin cells that are wet. It's trapped under there, mixed with sweat and dirt and, you know, debris, that kind of thing. Every time you squeeze it out, you squeeze out a little bit, but then it fill up again. All right, so there's the little cyst bank that she's got right there. There's not much underneath there. See how it dives under, how it's a different shape because it's been removed before. It's just seeing where the end of this, bottom of this cyst is here.
Yeah, the top is like a peanut. Maybe there's more underneath.
Yeah, let me just try to see if I can't take this off gently from you because there's a little scar tissue under there. This cyst is proving to be more difficult because if you don't remove it well the first time, it's harder to remove it the second time. Sometimes it grows away from where you initially think it is on the surface of the skin. See how it's stuck on her?
I felt that.
Okay. Okay, I think I got 99% of the cyst out, but there's this one little edge I can see really down deep, but it seems to be hooking around some scar tissue there, and I really need to be very meticulous about trying to get the entire sac out, because if I don't, it's gonna come back again. It could be even worse. There's scar tissue there. They make that noise though too. That's what kept giving you stuff. It was still filling in. It was like kind of tucked in one angle. That part was just opened up a little bit, but I got the whole thing.
Just to see that it wasn't that deep at all and caused all that trouble, it was shocking that it wasn't as bad as I thought it was, and I'm grateful it wasn't as bad as I thought it was.
So you want to take a look at it?
I do.
Okay, it looks good.
Thank
Okay.
you so much,
Oh,
Dr.
you're so
Lee.
well. Thank you.
I will not miss popping this stinky thing. I will not miss it. I don't have to worry about it growing back. I don't have to worry about my bra scraping it. I didn't feel a thing. It was good, and I'm excited, and I know she got it. I know she had it all.
Okay, Miss Stylish Lady, you can be even more stylish now with this thing gone.
Yes. I'm going to be able to go to the gym. I'm gonna be able to walk around like really cute in my little sports bra and my little shorts. I'm excited about that.
Hopefully that doesn't come back. You'll let me know, okay?
I will let you know.
Okay. Bye, sweetie.
Bye, Dr. Lee.
Okay, so let me just see what we got here. Just gonna draw on your hair first to see where this is. Just kind of figure out what we're gonna do to keep this looking pretty here. So I'm gonna put some numbing there. You might feel a pinch on the surface, but the area will kind of get bigger because it's gonna get filled with a little fluid there.
Okay.
Knowing that Terry is experiencing some pretty severe pain in this area makes me proceed with caution. Tumescent anesthesia is key here. We're really going to flood that area with numbing to really try to lift this growth up and separate it, because I think it's pretty inherent to his muscle and bigger nerves underneath there. And when I'm making an incision, I'm looking for big blood vessels, potentially nerve fibers. I want to make sure this is not intertwined within his muscles and potentially kind of impinging on some of the bigger nerves that are really important to his functioning of his leg. Let's see whether this is something I can remove. I'm gonna just be a little bit more timid, more conservative, and just kind of take a peek and see what we have going on here.
Okay.
It looks like a lipoma, and it's a lipoma. So I think we can remove it, okay? Thankfully, I was afraid I was gonna have to give you bad news. Okay, I'm gonna give it a squeeze. That might pop out.
Doctor, what kind of concerns do you have with the pain that he's been experiencing?
I'm treating this very conservatively and timidly. I'm trying to see if I can pop this out whole. I mean, and that would be nice, because then we know we got it all. And certainly I don't want to disrupt anything underneath. Hopefully this will get rid of his pain, but I don't want to anger that nerve either so that it's always firing and causing pain. So just, sorry I'm making that noise, but I'm not trying to have a bowel movement or anything. I'm just trying to squeeze this. This is actually pretty tucked under here. The good news is that this looks like a pretty benign appearing lipoma, but part of it is still adherent. If this lipoma is intertwined with some really big vessels and nerves under the skin, I'm not gonna be able to proceed. It's over. It's like coiled in there. It's like twisted in there. Oh my gosh.
This program examines dermatological conditions and the procedures involved with treating them. Due to the graphic nature, viewer discretion is advised.
This is actually pretty tucked under here. Come on. It's like coiled in there. It's like twisted. I'm here with Terry, and it's as if his lipoma wanted to come out. It really kind of expanded and really pushed its way out. However, the bottom part of it seems to be pretty adherent and a little stubborn. I really don't want to disrupt many nerves underneath there and cause him more discomfort in the end. Just have to be gentle. That's what it is. Be even extra gentle right there. Look at that. It's pretty heavy. Make sure I don't tug on you and pull on those nerves, or we don't want to get angry. But I'm close here now. Just the last little bit that's almost there. All right. Let me just check it out now. We got it all off.
I'm ready now. Stitch me up, I'm ready to go.
You gotta rest a little bit.
I know, I'm just happy.
I'm just checking whether I see any, nerves that might have gotten irritated by this. Thing looks pretty good. The giant lipoma has really been causing Terry a lot of pain. Hopefully, I've been able to get it all out and not disrupted any of the nerves around the area. So hopefully he can get back to a much more normal life now. All right. I think a mirror might be easier for you to see. It's a little bit filled with fluid still, but
okay.
But look at that good-looking hip now.
Oh, wow, that's neat. Now that this bump is gone, I'm excited because I can buy new clothes and I can just go be in public. I ain't got to worry about my job. I can go through security without being scrutinized, worried about if I'm stealing something or what I got. It's a different chapter now.
You were fantastic, and I'm so lucky to know you.
I'm just so happy that you're able to help me.
I know, it's gonna look great. It must be so relief. Oh my God, I bet you're such a tough guy. You never do that, so I feel honored.
It's just a relief.
Yeah, you did so good, too. I adore you, okay? We'll put a little bandage on you, okay? Thank you.
I've been carrying this around for so long. When I looked at it, I was overcome with emotion to actually see my leg looking normal again, back to where my leg was before this bump, because I didn't really believe it was gonna ever be like that again until now.
What do you think it's gonna weigh?
3 pounds.
3 pounds, okay. Yep. 1.54. Typical man, always think it's bigger than it is. Feel that, that's got some weight to it.
I want to say thank you, Dr. Lee. You have made a major difference in my life. I get to live my life again. I get to live a normal life. All I ask for.
Thank you.
Thank you.
Okay, just make sure I'm not hurting you at all. I'm gonna try to not kick out any of your hairs if I can help it. I'm gonna push against you, okay?
Did you cut it?
Feel that?
Yeah. Yeah.
You have a garbanzo bean in your head.
I like to compare a lot of the bumps that come out of people to food, and I just feel like it's a really lighthearted way to do this. I mean, it's better than me comparing it to spider eggs or something gross like that.
Okay, so there's this one right here. You see him under there? Maybe this one more side. The smaller ones are harder to get because they're like hidden, they're so small. I'm just having trouble finding that one.
Yeah, now it feels flat.
Yeah, see? Now it feels flatter now.
When Brandon came in, I counted 7 cysts, but when I go to remove them, there's only 6. I'm not sure what's going on here, whether I've lost the cysts, maybe evading me under his scalp, but I can't find that 7th cyst.
Where did you think it was? It wasn't really 2 eyes and a mouth?
I feel like there's one there.
You feel like there's one there where I am?
Mm-hmm.
So there's 5 down here, right?
Yeah, I guess, yeah.
Well, did you say that? Were you counting there 5 before here, or was that just
I
me?
guess I was miscounting.
I don't feel it anymore.
What's really weird here is that I can't find one of these cysts. I mean, it could be scar tissue, it could be a little baby BB cyst, and so sometimes those are hard to remove because they're so teeny tiny. It's almost like finding a needle in a scalp haystack.
You feel something there?
Feels like there is.
I don't feel it anymore. Yeah, I don't feel anything. I'm gonna put a stitch there.
So initially I thought there were 7 cysts on Brandon, kind of like the 7 little dwarves. But I guess the last one was sleepy because it didn't want to come out. I didn't see anything, so I closed up the area and hopefully there's not really a cyst there that was hiding from me.
Okay, next one here. Number 2, beans in your head. Okay, I'm shifting over here. Same thing over here now in this one. Loosen this up so I can squeeze it out. Sorry, it's weird, I know.
Did you get that one out?
Yeah, I did.
Nice.
So far, we got 3 for 3 whole. There was a pop.
Yeah, I
heard that one too.
I felt it, yeah.
Okay, last 2. I know, pushing your head deep in there, huh?
Yeah.
Here he comes, like a little trombone. All right, last one. It's actually bigger than it looks. It's like flatter.
That was quite a splash there. I mean, it came out like a fire hose. I'm sure when I injected some anesthesia in it, I must have injected a little of that fluid under there, built up more pressure, and it was like a geyser. Sometimes the splash mask is not enough. I think I might need a helmet next time.
What, did it pop?
Yes, it did. It popped on me and us. We gotta take a shower.
Jeez.
Sorry, Valerie. It's okay.
Oh, no.
It's okay, don't worry.
Oh, God.
It's all right. It's older. It's more unhappy with us.
Do you want her to clean off your forehead a little
Oh, is my
bit?
forehead messed up?
Well, it's all in your...
It's in my hair?
Yeah.
You could see it. Yeah, why don't you do that?
She got sprayed. Or do you
I have a party to go to tonight. Now I'm gonna have to...
You need to shower. It's like, and it's all in the back of her hair, too.
Thank you, darling.
We did it, all done. What was, we thought 7, ended up being 6, and what better way to relax a patient than to get splashed by their cyst juice?
You wanna see your head?
Yeah.
I'm lost for words. I'm still processing it. Just getting all 7, or actually it was 6 lumps removed. So I guess I must have been counting one twice, or one just disappeared.
You did really great. You know, pilar cysts are really common. That's what I think these are.
Okay.
But we're gonna send those out for pathology. We just wanna make sure that these are nothing to worry about.
Thank you so much.
Oh, you're very welcome.
Now Now that the bumps are removed, I don't have to worry about photoshopping my wedding photos. My mother-in-law can't call me lumpy anymore because I don't have any. I'm not gonna let her see me with this setup though.
Doing awesome, girl, awesome. Brandi came to visit me today. She's a wonderful young lady who has this big growth above her left breast. Really this kind of third boob. I'm trying to get this out really carefully and efficiently, but also I need to make sure she's comfortable and she's not freaking out. The fact that I'm pulling out this mass from her chest, inches away from her, using a sharp blade, a single glance would be something that you would never forget. You're okay?
Yeah.
Okay, good. I see it. I got my finger on it, so let's try to get it out here. Are you okay? Yeah, make sure you get good oxygen there. You're a woman. That makes it tough. I know you are. I know, that's why I'm stopping. I'm just trying to make sure you remember to breathe and get good oxygen in your lungs. Yes. So I'm gonna squeeze you just because I'm trying to get it out of a small little hole here, okay? You okay?
Yeah.
You're doing awesome. Gonna wiggle you around. People have asked if they can keep it. People definitely ask if they can hold it. People ask how much does that weigh? You haven't done any of those things, huh?
No.
Not necessarily. You have to pay attention to how the patient is feeling. And part of that is talking to them too. If you're thinking about how to answer a question, you're not so thinking about what's going on. Would you say it's a he or she? I don't know. It's really important here that I protect Brandi and her mind, really. That hurts right there? I know, your nerves are getting, but you almost got him.
Good. Okay,
I just need to wrestle with him a little bit. I'm sorry about that.
Okay.
But if you can handle me wrestling with him, it'll be better in the long run.
Dr. Lee was comforting me, but I started feeling like I might get sick. I really don't know if I can get through it.
Ow. Okay, I'm sorry. Ooh. I'm sorry, I'm sorry. Oh, you hate this. You hate this. This lipoma is a bigger problem than I expected. It's not really popping out nice and easily. It's found little nooks and crannies to kind of hide under. And I'm also aware of the fact that my pulling and pushing on her is freaking her out more. But I'm trying to get this out as quick as I can. I'm just using my fingers, nothing sharp.
Okay.
You're doing awesome, girl. You can do this. You can do anything. But he's almost all the way out here. You're doing awesome. Oh, you're over here on this side. All right, honey, all right. He's just stuck to you a little bit here. We got him, though, we're getting him. Ouch. Okay, okay. That was the last big piece. Okay, let's take a look again. Yeah, it feels good to me, okay? All right, guess what? I'm stitching you up and we kept it nice and small.
Thank you.
Okay, you feel okay? Every time I tried to probe into the farthest edges of where the lipoma was, she was uncomfortable and this was increasing. So I decided to stop. I think we got it all, but you know, there's always a chance that a lipoma can come back, so I'm crossing my fingers. Ready? You okay?
I feel great. I'm just teary-eyed because I'm like excited.
Oh, I'm glad. It looks really good.
I had a lot of anxiety going into it, and I had the shaky legs and a little queasy stomach, but Dr. Lee talked me through it, and she was very comforting.
You okay? Okay. Do you want to see it, the lipoma?
Yeah.
Okay. It came out in pieces, as you know.
Ew. It's so gross.
You did really great, okay?
It's like a 10,000-pound weight lifted off my chest right now. Dr. Lee seemed pretty confident that the lump won't come back. She's pretty sure that she got it all out. I'm just so happy now that it's gone. Thank you so much.
Dr. Lee, it's nice to meet you. Thanks for coming out here and seeing me. Okay, you have a bump on your stomach. Okay, how long have you had this?
5, 6 years.
5, 6 years or so? Okay. And then it's just been slowly, gradually growing?
Yeah.
A lipoma is really a fat cell that decided to divide upon itself and have a little party. Anyone can get a lipoma. Some people get multiple lipomas, and some people, this runs in their family, that they get multiple lipomas. Have you seen any doctors for this before?
When I went to my doctor, they just told me it was a lipoma's growth, and then he was like, oh, it's nothing to worry about.
Does it hurt you, or does...
Like, if I put pressure on it, it kind of does. It's really large. It does stick out a little bit bigger than my boob.
Okay, well, I'm glad you're here. I hope that I can help you.
I hope so, too.
I'm gonna take a look at what the area is. Now, I'm gonna shut the door here, and you can just show me if you wanna stand, if you wanna sit, whatever's best for you, however
I'll
best to
probably
kind of
stand
show
that way.
this.
You can kind of see it more. Okay. So, it's pretty large.
Okay, my hands are freezing. I'm so sorry about that.
When Dr. Lee was examining my lump, she was very gentle. Definitely made sure that I felt comfortable, you know, lifting up my shirt and examining it.
This is quite a large bump. I mean, it's not as big as I've seen some of them, but I think that the main reason that this is so upsetting to her is because of where it is. It really looks like it's a third boob. I want to make sure we can do a nice excision here. It's going to get rid of this extra flap of skin. We already have 2 boobs. We don't need 3, right?
That's what I feel like sometimes.
I know. Hey, you do have a little bump under there, huh? I'm gonna just feel around on you. There's something that moves around under the skin. In fact, if I move it, you can see it. See it shifting right there? So there is something under there. It moves around. The fact that something is hard there really makes me suspect there's possibility that there's something bad going on here. It is a little bit bigger than I expected here, so I think what we need to do is we need to prepare ourselves for this. I need to take a good look at this. I'm gonna, in fact, take a little video with my phone. And see if I can take a look at it and think about how to best do this. When I prepare for a surgery like this, I go through the whole procedure in my mind. What instruments I'm going to use, what instruments I need to bring into the room, what type of suture I'm gonna use, and what type of incision I'm gonna make. Because I want to obviously get rid of this bump, but I also want the patient to be happy with the outcome. I use a lot of pretty cool, complicated, even expensive tools in surgery, but one of my most important tools is my Sharpie. If we make a little incision, I'm gonna try to hide it like in this little kind of crease right here. All right, perfect, I like it, okay. You're gonna see it's gonna be a piece of cake, okay? You're doing fantastic, girl.
I'm really, really nervous.
Oh, try to relax.
I'll be all right.
Okay? You are gonna be all right, I know you are, because you're a tough woman. All I'm gonna do is put a little, hey, don't look. No need to look.
God, a needle. Okay.
Just one little baby pinch, okay? Just one little baby pinch in your skin. Okay, let me put some numbing there, okay? Nice and gentle. You're doing awesome. One of my keys to my existence, really, is to just make sure people are comfortable, because that's the difference between what I do and what like a general surgeon or a plastic surgeon or other people in surgery do. We do things under local anesthesia. All right, you just make sure nothing's ever hurting you, okay?
I'm very nervous that there might be some problems inside. Who knows what it's gonna look like once they cut it open and take a look. My biggest fear is that it is attached to something, or there might be something else that we don't know. That's what makes me kind of scared.
All right, you just make sure nothing's ever hurting you, okay? You're doing great. What's interesting about lipomas is they like to find the nooks and crannies of our body. It's like a big blob that grows, and it just finds room to grow into. And when it doesn't have any space underneath, it grows up, and that's when you see it. Just gonna see if I can give it a squeeze and see if I can pop it out of here. You okay? I know I'm pushing on you.
That's okay.
I'm gonna jiggle you around, because a lot of times when I shake it, it'll kind of ease its way out too.
It wasn't like majorly attached to anything?
No, it looks like it's popping out, but I got like one little leg coming out still. Just kidding, it's not really a leg. There we go, it released. It reminds us a lot, honestly, of chicken. I'm sorry to tell you that. That was our little cute little friend. Now, why was it hard? It's hard right here. We're gonna figure that out in a bit. As soon as I removed that lipoma, I immediately examined that hard spot to see what it was. And I was reassured, because this looks like it's just scar tissue. I would send this piece in, but still send the whole thing to pathology. A pathologist is a type of doctor that examines tissue and gives you a diagnosis. Even though I'm 99% sure that that hard spot is likely scar tissue, I'm gonna send that to the pathology lab to get confirmation. Okay, now for the fun part. Trying to fix this up to make sure it looks good, okay?
So it's all out?
It's all out.
Oh my goodness. Can it come back in that spot?
I don't think so. It looked like we got it.
Okay.
Do you want to see it?
Yeah. Oh my God, that is huge. It looks like boneless chicken.
Big breast, it's a big breast.
I don't think I can ever look at chicken again the same.
All right, girls, good job.
Thank you so much.
Thank you, honey. You're awesome.
I just want to say thank you for making this dream come true. Thank you so much.
I'm just excited that I'm now gonna start my new life and my new chapter, and now I don't have to feel insecure. That's an amazing feeling ever. Sorry. Oh my goodness.